complex care is really a level of care that we identify for patients who are no longer in their acute phase of their illness. But we also know they're not ready yet to go home, whether home be their own residence or retirement home or long-term care. So it's sort of a transitional place where we provide extended medical care to a point where with therapy and with good enhanced medical services, we can get people to a place where they are stable and they can then medically be cleared so that they can go home and function in their home and live a good productive life, you know, just like they did before they came into hospital.
We have at least 80 medical beds that we utilize daily. We often overflow with more patients into those beds, and really we see most of the patients that are admitted through the emergency department come to medical beds.
It's worrisome, you know, when somebody's 92 years old back, you know, last Labor Day. It's always scary when you're in hospital, you know, with issues. So it's nice to have people helping you out, giving you that information you need. And I just have to thank everybody.
We use the team approach to set up their care and to make their hospital stay as pleasant as possible and as short as possible. We have a great team. It means we come to work, we're positive, we have lots of energy.
Patient-centered care means looking at the patient's needs, their goals, including their family, and working together with them to reach those goals and to make sure they have the best care we can give them.
Oh, they were very good to me.
And we were able to get you home.
Yes,
yes,
nice.
With your family, which was the most important thing. Yeah.
We see people who have had strokes and have, you know, again, gone through the acute phase, and over time they've progressed through therapy and with medical care. We see people with diabetes, we see people with congestive heart failure, COPD, so just a wide variety of those chronic illnesses that often exacerbate someone's acute illness.
So infection control is really important, very, very important with our medical patients, because oftentimes our medical patients are elderly, they're seniors, and they are more vulnerable than the general population. And we know that more and more of our patients are in that category of senior category. So they're vulnerable and may have antibiotic resistant organism. We still go through that whole isolation control procedure of, you know, wiping down all of our equipment. But to do that and to provide the best possible care, it's always best to have dedicated equipment. We're extremely grateful and would like to, from the bottom of our hearts, thank everyone in the community for contributing and making that possible.
Nobody wants to be in hospital, we all know that, but when we have to be here, then it's nice to know that that care and support is here.